What are the things that you can do to strengthen your immune system now so that even if you're exposed to COVID or any other germ, you can help fight it off? That's a key part of the discussion that I think has been left out, and I want to focus on it today, and specifically what role vitamin D plays in that. I'm Dr. Darria. I'm your go-to frontlines ER doctor. I'm a mama, and you know that I take the very best evidence and information to help make your life healthier, better, and easier. And today I really want to focus on how to fortify your health, because in the discussion of COVID, we've been talking about how to eliminate your exposure to COVID. And that's important because if you're not exposed to a virus or a bacteria, you can't get sick from it. But there's another key component, and that is how to fortify your immune system, or to make yourself what we call a bad host, which means that even if you do get the virus or any other infection, your body and your immune system can fight it off better. This is really crucial, and I've started to talk about this more and more on my Instagram account and in other places, because these are the common everyday things that you can start doing today. In addition to all the other things to avoid coronavirus, there are things you can start doing today to decrease your risk of having a complication or to decrease your risk of death from coronavirus. So what role does vitamin D play? Now, of course, I am outside today. Notice I'm not in my normal office. I just needed to get outside and get some sunlight. And I figured what better topic than I'm talking about vitamin D. We can do this outside. There have been some really interesting reports talking about an association between having a low vitamin D level and increased rates of complications, ICU stays, and mortality from COVID. One report even showed that people with low vitamin D levels had 10 to 20 times higher mortality than people who don't have low vitamin D levels. Really big difference we're seeing there. Now, of course, I wouldn't be your favorite doctor looking at the best evidence if I didn't dive in deeply enough and say and highlight that there's a caveat here. All of these reports show an association. They say that people who have low vitamin D levels also have increased rates of mortality and complications. They don't prove that it was the vitamin D that caused it. There's not a double-blinded randomized controlled trial on vitamin D preventing coronavirus mortality. There are some studies underway, but none yet. But here's why I don't think we need to wait for a double-blinded randomized controlled trial on vitamin D to start making sure that we're getting enough of vitamin D and paying attention to our vitamin D levels. For one, there's some pretty strong evidence that I just mentioned about coronavirus and vitamin D and some ties there, and I'll talk in just a second about why. Secondly, we know that vitamin D is important for other systems of our body, including the musculoskeletal and bone system. And thirdly, we know that at least 40% of the United States population is so deficient in vitamin D that their levels are low enough that vitamin D and its associated hormones may not even be able to physiologically function properly. So all of that together says to me that we definitely should be paying attention to vitamin D and making sure we get enough of it, okay? So first of all, who is deficient in vitamin D? So we need to look at those populations. So of course, the people who are deficient in vitamin D are the same ones that we're seeing higher rates of complications in, the elderly. Why in the elderly? Well, for one of the biggest sources of vitamin D is conversion into the active metabolite in our skin. Well, as you get older, this process becomes less efficient. Who else? People who are obese. Why? Because vitamin D is a fat-soluble vitamin. So your body stores it, and if you have higher amounts of fat in your body, it holds on to that vitamin D and doesn't release it back into the bloodstream, which is where you can be using it. 3, people in northern latitudes. We're not getting as much sun, we're more covered up, so you're just getting in general less sun. And also darker skinned people, because the more melatonin you have, the less efficiently you make vitamin D. Really important to note that. Those are the groups that are most at risk. Most people in the United States have some degree of lower level of vitamin D, but those are the groups that are most at risk. Now, why? Why would vitamin D, which, by the way, isn't a vitamin and actually a steroid hormone in our body, but why would vitamin D play a role? So it seems that there are 2 potential roles. One is an immune system role. It seems that vitamin D has some antiviral properties and actually can stimulate our immune system. Some studies have shown that vitamin D is protective against respiratory infections, and that daily or weekly supplementation of vitamin D for people who had lowest levels of vitamin D reduce their risk of respiratory infections by 50%. For people who had more normal levels of vitamin D, it still reduced their risk of respiratory infections by about 10%. So there's some immune system function there. There's also a second function that vitamin D plays. Now, many of you have heard about the ACE2 receptor. The ACE2 receptor is a receptor in our body to which the virus attaches and gets brought into the cell. But ACE2 does a whole lot of other things beyond that. And vitamin D seems to regulate ACE2 in another system that ACE2 is affiliated with called the renin-angiotensin system that modulates our blood pressure and a number of other effects. But both of these systems, the ACE2 and the renin-angiotensin system balance, really get disrupted in COVID and especially in cytokine storm. What does vitamin D do? So vitamin D regulates ACE2 levels and also regulates that renin-angiotensin system. So you're less likely to get acute lung injury and ARDS. So two key mechanisms by which vitamin D may play a role when it comes to COVID. Now, you'll be asking me, so, okay, great, I'm sold. How do I get some vitamin D? So first off, you see, I am outside today. Sun and the way our skin converts to the active form of vitamin D is one of the most efficient ways that we can get vitamin D. But of course, you don't want to burn. So, and of course, I am a huge proponent of wearing sunscreen. I put sunscreen on my kids. We always do that. But it really actually doesn't take too much sun exposure to get vitamin D. In fact, I read one in a study that just a brief casual exposure to your arms and face to the sun is about the equivalent on average of about 200 international units per day of vitamin D. So if you really just go out and get 5 or 10 minutes of sun unexposed on a given day, ideally between 11 a.m. and 3 p.m., you're going to start getting more levels of vitamin D in your blood. It's just that most of us don't go out anymore. And when we do, we're all covered up in sunscreen. So I'm not telling you not to use sunscreen, but I'm saying that maybe for about 5 minutes a day, it's okay if you go out, just get a little bit of sun, feel that vitamin D, just build it up in your body. That's one way. And of course, everybody is different, depending on what latitude you live in, how much melatonin you have, how much pollution is in the air. There's a variety of things that will affect exactly how much vitamin D your body makes. So that's the first thing. Now, second way to get vitamin D is food. We can get it in the foods we eat. So what are good food sources of vitamin D? Salmon, trout, herring, eggs are a great source. Some oils, cod liver oil, also flaxseed oil, maybe it's slightly more palatable. Fortified milks, dairy milk, soy milk, nut milks can have good sources of vitamin D. Just check on the label. And fortified cereals and also some wild mushrooms. So there you go. There are some food sources. Make sure that when you have those foods, that you eat them with other food that has fat in it. Because remember, vitamin D is a fat-soluble vitamin, so you need to eat it with fat for your body to be able to absorb it the most. The last way to get vitamin D is in a supplement. To get it in a D3 supplement is one of the ways. Now, again, when you take this, if you take it, you should be taking it with food and with fat again so that your body can help absorb it. How much to take? You want to be careful because remember, too much of a good thing is never a good thing. Even vitamin D and especially some of the fat-soluble vitamins because they can just accumulate in your body. But for bone health, it's advocated around 600 to 800 international units per day. This is really one of the places where it's best if you can check your levels, have your doctor guide you on how much you should be taking and recheck your levels in a month. If you can't get in to see somebody or get your levels checked right now, most people could start with around 1,000 to 2,000 international units of vitamin D per day. That's assuming that they're otherwise healthy, have a normal functioning kidney system and everything else. But I personally take 4,000 international units per day, but that's under the guise of my doctor and following my levels and knowing what I need to take. The Food and Nutrition Board of the Institute of Medicine says not to exceed 4,000 international units per day. So there you have it, kind of where to start. And I say again, anywhere from 600 to 1,000, perhaps up to 2,000 international units per day for a short period of time until you can get your levels checked would be a good place to start. There you have it. Now, in this Fortify series, I'll be diving deep on a number of other ways that you can fortify your immune system from the inside out so that you can protect yourself and your family against COVID or whatever else comes down the road. Let me know what questions or comments you have or any potential topics you'd like me to cover. Please share this because it's so important that we not only know how to minimize our risk of exposure to COVID, but also how to fortify our immune system and our health so that we are stronger if and when we do encounter COVID. Let me know what else you want to know about. I'm Dr. Darria. Stay well, and I'll talk to you soon.